Key aims in migraine management are to eliminate pain and prevent attacks. But increasing evidence on the burden of disease is leading to clinical trials investigating the impact of therapies on patients' lives as a whole, in terms of reduced disability and improved quality of life. Migraine Buddy is a smartphone app that collects information on the impact of chronic migraine on activities of daily living, along with symptoms, triggers, and other migraine characteristics. According to data collected to date, patients with chronic migraine experienced attacks on average 184.4 days per year. 25% of attacks involved moderate to severe pain, leading to absenteeism from work. Approximately 40% of patients with chronic migraine experienced anxiety or depression during attacks, and home activities, productivity, and sleep were highly affected. Research has shown that patients are willing to use non-pharmacological treatments to control the impact of migraine, including acupuncture, hypnosis, non-invasive vagus nerve stimulation, chiropractic, and osteopathy. Acupuncture is used worldwide to reduce migraines. It seems to act by stimulating the pain control centers in the brain. In a comparison of acupuncture, hypnotherapy, and pharmacotherapy, 30 patients received 10 acupuncture sessions over 3 to 4 weeks, using the same 39 points at each session. Patients achieved significant reductions in migraine pain and migraine-related disability that persisted to 3 months. In the same comparison, a second group of 30 patients received 10 hypnotherapy sessions over 5 weeks to teach them relaxation techniques and techniques for mentally taking control of symptoms as patients sensed the onset of a migraine. As with acupuncture, patients achieved significant reductions in migraine symptoms that persisted to 3 months. Non-invasive vagus nerve stimulation, or NVNS, may be an alternative or add-on to pharmacological treatment for some patients with chronic migraine. Acute NVNS treatment quickly and consistently reduced pain intensity and reduced the need for rescue medication in the PRESTO study. The effect was more pronounced when the device was applied when pain was still mild. Chiropractors treat patients with migraine, tension headache, and cervicogenic headache. A recent survey found that the most frequent therapeutic approach for migraine management included non-thrust spinal mobilization in association with advice on headache triggers and stress management. The vast majority provide more than 5 treatments across 2 to 8 weeks for patients presenting with headaches of more than 3 months duration. Osteopathic manipulative treatment, OMT, may be used by trained practitioners to treat chronic migraine in patients who do not want or who are contraindicated for pharmacotherapy. Manipulation of the fascia around the cranial bones removes restrictions on the vagus nerve and, thereafter, musculoskeletal restrictions. Cranial osteopathic manipulation is thought to increase blood and lymph drainage, specifically for the sinuses, decreasing pressure and relieving symptoms of a headache. In conclusion, non-pharmacological therapies offer effective management of migraine pain, reducing the disability associated with these headaches, and improving patients' ability to live a normal, productive life.